Good afternoon and welcome to HCAF's first Facebook live stream. I'm Kyle Simon, HCAF's Director of Government Affairs and Communications, and your moderator for this timely update for Florida home health providers. Today's discussion will be brief but informative and focus on the Medicare Review Choice Demonstration. As you likely know, the Centers for Medicare and Medicaid Services announced last Friday it will continue with phased-in participation of the Review Choice Demonstration for an additional 90 days due to the continuing public health emergency. Please join in the conversation by posting your questions and comments in the Facebook comment feed, and our speakers will address them as they come in. And stay in the know about RCD updates and continuing education opportunities by visiting our website at homecarefla.org. With that, I'll go ahead and turn things over to HCAF's Director of Clinical and Regulatory Affairs, Patti Heid, and Beyond Home Health Care Services CEO and HCAF Vice President, Teresa Gates, to get the conversation started.
Hi, everyone. Thank you for joining us today. Before we get started, as Kyle noted, CMS has decided to extend the phased-in approach for another 90 days for the state of Florida. And today's just meant to be an informal conversation just to give you a high-level overview of some next steps to consider as we move forward in the demonstration. But before we get into that, what we thought we'd like to do is to hear from somebody who has been participating in pre-claim review and has been very successful at it. So as Kyle mentioned, we're joined by HCAF's Board Vice President, Ms. Teresa Gates, and we're going to talk to Teresa a little bit. So Teresa, welcome. And first off, why don't you just tell us a little bit about your company and your role within your organization?
Well, thanks. Thanks for having me, Patti. Really a pleasure to be here and talk about RCD. We are a Medicare certified agency here in Jacksonville. We started around 2013. We work in the 6 counties surrounding Jacksonville and have a census of around 200 patients, and have been doing RCD now for quite a while, and just excited to share that with you.
Okay, so we know that as of August 31st of 20, Florida was supposed to go into mandatory 100% participation in pre-claim review or in RCD. And at that time, we were afforded the opportunity to go into a phased-in approach. So when did your agency first start submitting for pre-claim review?
Yes, well, back in August, the first week of August, we started prepping. And then when we found out that there was going to be a delay, we felt, all this work that we've done up front to start preparing for RCD, we went ahead and phased in. And we did somewhat of a phased in approach over 10 weeks. So not sure if the members on the phone remember, Melinda Gaubery did a webinar around that time at the end of August and gave an example of a ramp up schedule, kind of starting at 10% one week and then going to 15 and then 25 and all the way to 100. By mid-October. We kind of took a little bit longer. We started at 10% that last week of August, and then at least by the end of October, we were at 100%.
Okay, and with that 100%, I'll let everybody know you guys have been very successful. You have a 99% affirmation rate. That's fantastic. Yeah. Congratulations. Kudos to you guys on that. So what are some things that you and your staff have done or processes you put into place that you believe contributed to your success?
Well, we knew up front that this was going to be an interdepartment success. Like, in order for it to be successful, we knew that it was billing, quality assurance and quality education, clinical management and marketing and sales, as well as the clinical team. We knew that we needed kind of an all hands on deck approach. And we knew that getting together a committee, or we called a task force, to say, okay, let's come up with a smooth process that also defines roles within the RCD process. So I think one of the first things we made sure that we had was within our own EMR, what are some barriers to make this a smooth process? Because we know everybody's on different EMRs. And for us, we didn't, all of a sudden there wasn't an active live button that said push RCD and here automatically your submission just goes to Palmetto. We knew that it was going to be multiple steps, and we still had to follow the other process of intake through admission of a patient. And how did we intertwine RCD in that? So we actually came up with, after the task force got together, we came up with a PDF writable document that contained the 7 tasks, and the 10 questions. And it was a writable PDF that went through the questions that our QA department, when they were QAing the Start of Care, OASIS, and Plan of Care, as well as the discipline evaluations, answered those questions on the writable PDF and submitted that in the clinical documents. On top of that, we had our quality assurance department finalize and approve the face-to-face. So initially in our workflow, our clinical management team reviews the face-to-face and ensures that we have, all the criteria met to start the patient, so to speak. And then the finalization of that and naming it task 1 in the clinical documents was very important by our QA team. So proper labeling up front so that our biller could easily pull task 1 being the face-to-face, and then those questions being answered on a writable PDF that was electronic that we just submitted and scanned into the clinical documents, I would say was the biggest success. Now, looking back at that, we were on version 9 right now, meaning, through those first 10 weeks, we went through multiple versions of that question based on feedback of the process. We started working, we forgot something on a question, or the biller would come back and there was, it wasn't very clear, so we had to clarify some of the questions on there. So I would say initially that was a great success, is to have that, really that writable PDF, and then define roles. So, once you're submitted the RCD, then you start to receive sometimes phone calls from Palmetto. So in your office, clearly for us defining who's going to take that phone call, and who is going to be that person, and then who is plan B and plan C if that person's busy, was very important, because you learn as you receive those phone calls. So I would say initially those were our great successes, and that has we've kept that same process and kept that 99% because of it.
Sorry, I had to unmute myself there.
That's okay.
So, are there any lessons learned or helpful tips that you might be able to share with the providers that are listening, especially those that haven't dipped their toe in the pool yet and are considering it with this next phased-in opportunity?
Right, absolutely. I will tell you, just hearing from the task force and those that are kind of boots on the ground, when those phone calls come, they're learning as well. That was the big thing we learned, is that the auditors at Palmetto are learning this process as well. And I will tell you, at first we would kind of get nervous. They'd call and the person would say, okay, we'll call you right back. Let's look at the record. And now we found what's most helpful, again, is if your biller or whoever's in charge of submitting the RCD, for us, we took that file and kept it in the clinical document. So whatever was submitted in PDF format is exactly the same. That is right there in the clinical document. So when that person called from Palmetto, we would make sure that we would ask, do you mind holding while we review the chart with you? Because typically they tell you right on the phone, we are partially affirming you because speech therapy has goals but no interventions on the plan of care. That's just an example. So if you have the whole submission right there, you can scan through it. And I'll tell you, there were a couple of times that we found the information just not in the exact spot that maybe it should have been. And we're able to locate it while that person was on the phone from Palmetto and say, oh, you're correct. It wasn't on the initial plan of care, but we see it's on a verbal order that has been signed, and can you accept that? That was one of the things that was a very helpful tip as we grew, knowing, we don't need to be nervous. They're trying to help us as well. And sitting on the phone and going through that record was an educational piece. There were times where we did say, we're going to take this call, we're going to call you back. We need to look into it further to find out. Truly, we did make some errors. We uploaded the wrong face-to-face. Sometimes it was in the chart, but then we had to resubmit. And very quickly, we were affirmed after provisional or partial affirmation. So those two are very good, helpful tips. Having the whole submission very handy for those people that are going to be calling from Palmetto, and then making sure that you feel comfortable discussing on the phone with them what they're looking at as partial affirmation. And I would say that those are helpful hints.
Okay. And we do have a couple of comments or questions that have come in. Linda was asking, what is your volume or number of submissions weekly or monthly?
So we are at 100%. So we probably do 20 to to 30 RCD submissions a week, or 120 a month.
Okay.
We are up to 600, I just looked, 620 claims since, the beginning of September.
Okay. And when you initially started, how many would you say you were starting to submit as you started the process and began ramping up?
Right. So that very first week, I remember we submitted like 3. And we wanted to wait before and see what that flow was and the process. And those all came back affirmed. And then we went up to 6, and then we went up to 10. And we used a percentage of what we bill. So we bill about 120%. 120 claims now. So if we were to start now, I would say, 10% is a good number. That's 12. So that gives you a good pool of what you're looking at as far as process.
Okay. And then Zeta was asking, where do you label these tabs?
So depending on your EMR, when you save a document in your EMR, there's a way you can save it as something. So I know that some EMRs have labeling systems of their own, but there is usually a description you can put, or the actual PDF could be saved as something. So for instance, for face-to-face, we say FTF-task 1 in all caps. The description is task 1. We're in Matrix Care or Brightree, but I do know in Home Care Home Base, for instance, they have a description next to where you can save. And I would recommend using some type of descriptor if you have that in your EMR.
Okay. And then Zeta was also asking, can you explain the process for putting together the file that you get ready to export to eServices?
So what's really important, like I said, we have that summary of questions, task 1 through 7, and the quality assurance department answers them. And then our biller actually goes and PDFs each task and uploads it. Through the training we did in the task force, she understands what the face-to-face is, of course, because it's labeled, and the plan of care. But the actual process is ensuring that you have the ability to save your documents as a PDF or download them out of your medical record, and then you submit them through eServices on Palmetto through a PDF format. So I hope I answered your question there.
All right. So now that you have been doing this for a while, what's the overall general thoughts on the pre-claim review process, or, in your mind, but also maybe feedback that you're getting from staff? Love it, hate it, somewhere in between?
I would say, honestly, somewhere in between. I would say that, of course, initially, we wanted to go with this with a positive attitude and say, what can we learn from this? How is this going to strengthen us operationally? And to be honest, yes, our face-to-face process, we're pretty much like Tilla the Hun with our marketing team. So in the beginning, we're looking for those primary reasons for home health and the skilled services within the face-to-face. But we're really looking at, is it signed, is it dated, and all of that. And we're not starting services unless we have that information. So because we know how much of a delay it can be during the RCD process, we've tightened our ship, so to speak, in the beginning of our intake through admission. And that overall has helped our operations. If you think about it, that's going to help with scheduling and getting our paperwork in on time. So RCD somewhat helped us tighten up our operations. Is that going to, and then we had a mindset that this isn't going to go away. We know we're in a trial, but we know that the chase and pay, so to speak, mantra, if you will, with Palmetto before and with Medicare is no longer there. This was to take that away and to say, okay, let's see how you justify your services up front. So from an operational standpoint, it also has tightened our utilization of service, because we're able to say, listen, that second pair of eyes is now sooner than later in the care, in the episode of care. So we're going to help you. So we've done some extra documentation, skilled training, and as a result, we feel that our staff's documentation has gotten better because of this RCD process. On the flip side, one of the things I will tell you, we were all told that it shouldn't be an extra burden on the operations and the agencies, and I would have to disagree. There is slightly, I wouldn't say it's a major, like we need a whole FTE for a 200 census to manage RCD, but it certainly has added roles to multiple people. And I think that's another tip, is that not one person has to bear all of this. If we can divide this up in your agency operationally and take on a little bit at a time, I think it can be successful.
All right. Well, and I see we have some more technical questions coming in. This is going to be just, again, a higher level kind of informal conversation, meant to be a little on the briefer side, mainly because we're trying to be respectful of everybody's lunch schedules today. But that being said, if you feel like you would like a webinar that HCAF would put together that would give a deeper dive into RCD, feel free to send those comments over to us. Any questions that are a little too technical for this presentation today or this conversation, we will keep track of those, and we will definitely look to address those in an upcoming webinar for you.
So, Patti, can I ask you a couple questions?
Sure, fire away.
Okay. Well, we know that the phased-in approach has now been extended another 90 days. What does that mean here for Florida? Can you help us understand it?
For sure. So we all get a little bit of extra breathing room, right? Everybody just kind of, I think, did the collective sigh of relief when we said, okay, yes, we get another 90 days. However, what this doesn't mean is that you get to sit back and not do anything until you wait for it to become 100% mandatory. This is your opportunity, and I'll keep saying that word, opportunity. No other state that has gone before us has had this opportunity or this chance to dip their toe in the pool without having to do a dive into the deep end. Some of us may do a swan dive. Some of us may do a cannonball into the deep end, depending on, your agency and your processes. But it is an opportunity to get into the pool and start testing the waters, because at some point this will become mandatory. So now is your chance to work things out. Take Teresa's words of advice. And she mentioned Melinda's previous presentation with the step up or the ramp up process. That will give you a chance to see where the gaps lie, where your agency needs to shore some things up, so that when this does become mandatory, you'll be ready to rock and roll from day one. The other thing to keep in mind, for any claims that don't get submitted through the RCD demonstration or the pre-claim review process, those right now, because we're in phased in, will process as normal, as they normally do, and they will not be subject to that 25% payment reduction. And those claims, however, could be subject to post-payment review, same as they are now. And any claims that you do get a PCR decision on, and if you have a valid UTIN and they're submitted with the valid UTIN, then those won't be subject to further review. But of course, they still could be subject to review from other entities, such as the CERT process or RAC auditors and so on.
And when exactly did cycle 1 end in Florida?
Okay, so cycle 1 ran from August 31st of 20 up until February 28th of 21. So at this point now, providers should be receiving either in the mail or in e-services. They should be checking and looking for their affirmation rates. In e-services, you're going to look at the e-review tab, and there's an e-RCD tab. That's where you can see all your PCR decisions and as well as your affirmation rate. And if you didn't select e-delivery, then you're getting a letter in the mail that will talk about your affirmation rate and next steps. This result will help you determine what your next steps will be and whether or not you're eligible to select a subsequent review choice.
Okay. So cycle 1 ends in Florida, then what are the next steps for those providers who have been participating in RCD during this phased-in approach?
Okay, so everybody's checking their affirmation rates. And once you check that affirmation rate, you're going to be in one of 2 buckets. So if you're in bucket 1, those are the agencies or providers who have either less than a 90% affirmation rate, or you have not submitted the minimum of 10 claims in order to be able to to advance to the next step, so to speak. So if you haven't submitted the minimum of 10 or you have a 90% or less than a 90% affirmation rate, then in this bucket, you have to make a choice between choice 1, 2, and 3. So choice 1 is either to start or continue in the PCR process for another cycle. Choice 2 would be 100% post-payment review, or choice 3 would be a minimal review with a 25% payment reduction off the top. And the important thing to note about choice number 3 is once you select that option, you're going to stay in that for the duration. Now, if you're in bucket 1 and you do not make a selection during the upcoming selection period, then you're going to default to option 1, which again is the start. For those that haven't started PCR, you would start the process, or you would continue participating in PCR for the next cycle or for cycle 2. And if you've submitted 10 claims and you have a 90% or better affirmation rate, then you must make a subsequent review selection for cycle 2. And so this opportunity to make your selection, whether you're in bucket 1 or bucket 2, will be from April 1st to April 15th. So those are important dates to mark on your calendar. And then also Teresa, we sometimes get questions from providers just trying to figure out where their affirmation rate is derived from. So just a reminder that your affirmation rate is the number of your provisionally affirmed decisions, and that's divided by total number of decisions. So for instance, if you submit 100 claims and out of those 90 of them have a provisionally affirmed decision, then your affirmation rate would be 90%. And the one thing to remember too is that resubmissions are not counted into your affirmation rate. So in order to get to that provisionally affirmed decision, if you've had to submit 5, 6, 7 times, those resubmissions won't be counted into your affirmation rate.
Right. Okay. So then what are the subsequent review choice options for those who need to make a selection before cycle 2 starts?
Okay, so those are the ones that fall into bucket 2 now. So they've submitted 10 or more, and they have a 90% or better affirmation rate. So those companies get to choose between choice 1, which would be staying in and continuing in the PCR process for another cycle, or they would get choice number 4, which is a selective post-payment review. So it is a statistically valid random sample of claims that are chosen for review every 6 months. And again, it's post-payment review. Important to note, if you do select this choice, that once you select this option, you're going to remain in it for the remainder of the demonstration. Or they get to choose from choice number 5, which is a spot check prepay review. So every 6 months, 5% of their claims are going to get pulled and spot checked, randomly selected for review. And you can remain in this option so long as you continue to show that you're following the Medicare coverage rules and guidelines. And again, you have that 90% or better affirmation rate. If at some point your affirmation rate drops below 90%, then you're going to go back into bucket 1 and you're going to have to select between choices 1, 2, or 3 that we mentioned earlier. And again, for those in bucket 2 that get to make a subsequent review choice, if you don't make a selection, you too will automatically default to choice 1, which is the pre-claim review. And again, April 1st through April 15th will be when you get to make those choices.
Okay, so after making that choice, then when does cycle 2 actually start?
Okay, so cycle 2 starts on May 1st, and it's going to run through October 31st of 21. So it's a 6-month period of time. And I'm going to try my best here to show you guys just a really neat slide that Palmetto had put together for everyone. So bear with me while I go ahead and share my screen with you. Okay, so hopefully, Teresa, can you see the Florida state life cycle?
Yeah.
Okay, fantastic. So this here, you can see where we had cycle 1 start and end timeframes and when the results should be posting. And then here again is that all important April 1st through April 15th selection for cycle 2. So here you can see where cycle 2 starts on May 1st and so on. So you're going to see the entire life cycle for the state of Florida from cycle 1 all the way through cycle 6. And you'll see that RCD is scheduled to end. The demonstration itself is set to end on May 31st of 24. So I'm going to stop sharing that for you there. All right.
Well, that is a lot of information. And I think one of the things that helped us was to stay really in tune with what HCAF is providing for our agency as far as webinars and education and previous webinars that are available on these choices and these cycles that need to be, we need to make some decisions on.
Okay, well, and also now that we've kind of discussed cycle 2, where's your agency at? Where do you think you're going to land for cycle 2?
Well, I'll tell you, we are probably landing where we are right now. So we feel that we're going to continue with the 100% pre-claim review right now, get really a well-oiled machine moving. We did definitely have a 6-month ramp up, but we haven't done it for 6 months straight at 100%. So I think we're going to take the conservative approach for us and go ahead and go through the next 6 months. We, honest to goodness, have learned some operational process tightening, if you will, and interdisciplinary, interdepartmental ways we can work together on other systems and processes based on this RCD process we put in place. So there was some great benefit of the ramp up. Now we're going to see how these different roles work together at our agency to continue at that 100% claim review.
All right, so sort of the if it ain't broke, don't fix it kind of.
Exactly, yes.
All right, well, and I just got word too, I want to share with everyone that we already have on the schedule Thursday, April 8th. Save the date, folks, because we are going to do a deeper dive on RCD. It's going to be at 12 Eastern time with Melinda Gabori, and it's going to be a 90-minute session. So make note on your calendars, and you can always go over to our HCAF calendar of events page, and you can find out more details there, and you can register for the event. Any of the deeper dive questions that have come through today's chat will be passed on to Melinda, and we'll be sure that we get answers for you. So please plan to join us on that date. So, and it looks like we have a little banner put up there with the information related to the webinar. So Teresa, in finishing out, because we're closing in on the 30-minute mark here, any suggestions, parting thoughts that you want to share with everyone that took time out to join us today?
My suggestion is don't wait, start now. I think they really should start now. I get the anxiety. I get we were thrown major curveballs in 2020. I get that, but I think we're past dipping our toe in, and we're not going to get so many breaks anymore. So we are all part of this health association. We're members together, and if we all can help each other, using that forum and pass back some information to help each other, or if you have questions through the forum. But I definitely think don't wait, start now, and get a task force together. Get people from all departments together to get your processes down and ramp up to have a good goal in mind.
And Teresa, I'll add to that, for those agencies that have started the process already, and if you did not get a 90% or better affirmation rate, don't despair.
Yeah.
You know, use cycle 2 as an opportunity to look at the gaps. I mean, this is tremendous for you to be able to find out, okay, where are we falling short of the mark? And so then in cycle 2, you can, you know, wrap your arms around it a little bit better. And again, just shore up any gaps in your processes to help you by the end of cycle 2 to get yourself into a position where you are at a 90% or better affirmation rate. And as Teresa said, we're all in this together. I know we've heard this kind of that mantra over the last year and a half, but when it comes to RCD, you know, we are all in this together and as a community, and that's why we're hosting an event such as this, so you can learn from others who have been very successful in the process. Although there were some speed bumps and challenges along the way, you know, Teresa wanted to be able to share with you her experiences so that she could maybe help you from making some of those same mistakes. So thank you for Teresa for being here today for that.
Sure.
And I know as we wrap up, we'll have our contact information put on the screen here for everyone. If you have any questions for Teresa or myself, feel free to reach out. And we hope that we'll be able to see all of you or talk to all of you next week during Melinda's session.
Yep. Thank you.
All right. Thanks, everyone. Have a great day. And thank you for all you're doing out there. And thank you for joining us today.
Have a great day.